Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 38 weeks pregnant, so getting closer and closer to baby time. Today I thought we'd talk about something that comes up a lot around this time, which is natural induction. So I have a lot of moms that are about this time done being pregnant. We're tired, we're just ready for baby to come and getting anxious. So I'll get the question a lot is, will I induce naturally? And I don't like to really do anything until they're at least 39 weeks pregnant. And even then, I do encourage moms to go as far as they can through the pregnancy. And one of the main reasons is that there is this hormonal shift that has to happen between mom and baby prior to labor. And if we're inducing early, and that shift hasn't happened, mom could just have a harder time during labor. So my preferred method for inducing naturally is acupuncture. And again, that's something that I do try to push off as long as possible. If there's some sort of medical reason that your doctor is starting to talk to you about needing to induce early, I'm absolutely open to trying to do that naturally first without the use of Pitocin or things like that. But the OB has to be on board. And again, we have to all be on the same page with that. So again, what we do in practice here is acupuncture, and we have really great results with inducing. Usually we can make it happen within one treatment. However, it can take up to 3. So I let moms know that we would want to make sure that we'd have enough time if they needed that 3 treatment. Again, I usually just do it within one treatment. And again, it works very well. So that's usually what the method I use. Now, there's other things that you can do naturally to help kind of stimulate labor, get things going. Raspberry leaf tea is great to help get labor progressing. It's also a good uterine tonic, which means it strengthens the uterus. So that's something good for moms to be drinking. There's other things. Intercourse is good to help that oxytocin production get going, which can help jumpstart labor. Other things, castor oil has been used. Now, that's something that I really kind of hold off on unless it's absolutely needed if we've tried everything else, because castor oil, you can take it orally. You can also apply it topically to the cervix. However, it does upset the GI system, so you could get diarrhea, which would not be pleasant as you're going into labor. So I usually hold off on recommending that one. Other things are hooking up to the breast pump for nipple stimulation. Again, can get that hormone cascade going to help stimulate labor as well too. So again, I do try and hold off as long as possible, just again so that hormone shift is allowed to happen between mom and baby to help labor go a little bit easier. But there are things that you can do naturally, and also again, acupuncture has been one of the things that I have found most helpful for a natural labor induction.